Today I'm going to talk about the Medical Termination of Pregnancy Act, which the act is actually formed in 1971 to stop illegal abortions or unsafe abortion practices, so that we can reduce the maternal mortality. So that is amended in 2021. So the Parliament of India passed the Medical Termination of Pregnancy Amendment Act, amending India's 50-year-old abortion law that legalized abortion in 1971. Actually, the proposal started in 1964, and by 1966, the whole formalities were done, and finally it came in 1971. But there were many deficiencies in the law, and now it is again amended, and still there are many complexities which we are going to deal with today. Why this is important? 44% of the 48.5 million pregnancies that occur annually in India are unintended. Approximately 16 million, almost 77% of these unintended pregnancies result in abortion. So 8 lakh unsafe abortions occur in India every year. 10% of unsafe abortions turn into maternal mortality, and we have to really decrease the maternal mortality in our country. Even today, abortion in India is not considered to be the right of a woman, and women continue to face challenges while accessing safe abortion services. According to the MTP Act, abortion needs the opinion and approval of a medical practitioner, and a woman cannot get an abortion solely on her request. So actually, we are responsible for taking decision. Pregnancy can be terminated in certain conditions and indications only. So I am starting with my cases, which are having some complexities, and we have to see to it what can we do in these cases, and I will also need the opinion of experts and our leaders. So this is a patient, 14 weeks pregnancy, comes for termination of pregnancy as it was a contraception failure. She had 2 previous vaginal deliveries and both were daughters. She insists that due to wedding of her sister-in-law, she got late in visiting hospital. No ultrasound had been done according to her. In her family circumstances, she cannot afford third child. So I am taking this question for myself. Would I do the MTP? And if yes, then how will I safeguard myself from PCPND Act if she hides the fact about sex determination? So I proposes my answers, and then I will like for the expert to comment on it. So as we all know that now amended Act says that indications up to 20 weeks, in that we can do abortions for a contraception failure in any case. And suppose we refuse this patient because of the fear, then she will end up in a unsafe abortion tactics, and then she will have to. So we will, if we do not do the needful, then she will go to some private practitioner who is not entitled to do abortion, or something like that will happen. So it is better that we entertain her. And how to safeguard ourselves? Consent can be taken that she has not done any sonography or any other test for sex determination. So you can put that consent form in the file and you can get it signed by them. And I think expert can comment on this moment if anybody wants to say something about it.
Legally right now,
as per the MTP Act, we can't refuse.
Yes, we cannot refuse. So we have to do this thing.
But we can tell her to go for a family planning procedure. Like we can tell her to do a tubal ligation if she doesn't want any more children.
Absolutely. Absolutely. That is another point. And in this case, we have to...
She already has 2 children, doesn't want any more children. So I think it's best to family planning measures for her.
Yeah, absolutely.
We should strictly abide by those things. We should tell her that she should go for it. And then only will be the abortion.
Yeah, absolutely.
But Dr. Ila, can I say something?
Yeah.
Say something.
Yeah.
So while legally we are in, everything is fine, contraceptive failure, you can go ahead with it. But there are many times such situations, they give you that kind of feeling that, the patient has got a sex determination done. There will be absolutely no proof. But, something that the patient says, her body language, gives you that kind of, like you yourself said, that why didn't she come earlier? You know, a woman who's had 2 children is very well aware of the thing of not having her menstrual cycle. I mean, we get a lot of patients like this. So what we did, although it's not legally, I mean, we made an internal rule that we would only take up such patients if they had an anomaly, and then we refer it out, because somewhere down the line we felt that there is no way that we can actually say that a sonography or has not been done and the patient has not gone for an
Absolutely.
So we made our own internal thing, and we don't do it in our setup.
Yeah, absolutely. That's true.
Can I
We
intervene?
are always scared that the patient can be lying to you, and even then you have to do it.
Patel, sir, Patel wants to say something.
Say something.
What the government says about it, ensuring access to...
Ila, hold a minute. Hold a minute.
Sure.
So
Dr. Patel, we want your comment.
yes,
Yeah, sir.
if we go by MTP Act, then indication of failure of contraception is available up to 20 weeks of gestation. So legally, nothing to worry if at all we go for. But when she is having 2 female children, it is a vulnerable case as far as PCPNDT part is concerned. And when she has mentioned that she cannot afford 3rd pregnancy, then just to test her, we should tell that let us go with termination of pregnancy with tubal ligation.
Absolutely. That's true.
At all, if she is ready to go for tubal ligation, then it's fine, nothing to worry.
Okay.
One more thing can I say?
So, yeah.
Yes, yeah, I wanted to say that, see, doctors are not considered to be investigators.
Yeah, absolutely.
So if
That's
the
true.
patient is telling you that, no, I have not got it done, we have to take it at face value. And
Yeah, absolutely. There was a case in Kerala where the judge said the same thing, that whatever patient will tell you, you will have to accept it. So
And
it's
once she has given the consent, then we are safe actually.
safe. So what
We received a patient. 2 weeks back, we received a patient who had taken MTP pills from a chemist at the gestation of 13 weeks.
Oh,
my goodness.
He aborted at home. She came in a state of shock in our hospital. Code blue was announced. I mean, she underwent hysterectomy also, but she couldn't be saved.
Oh my.
So
My
over
God.
the counter availability of drug is the first one to be stopped. I
absolutely.
think we need to write to CJI to discontinue this availability of drugs on the over the counter.
Yeah, you're absolutely right, Dr. Sonal. There was a very strong this thing, and they were not giving it without prescription. But again, things have got a little relaxed.
Yeah,
Nowadays,
it
you are
is.
seeing patients coming after taking over the
After
counter.
unprotected coitus, they are taking pill 72, and if they are 2 days overdue, they take MTP pills.
Exactly.
As this issue was taken by IMA and Foxy in past, and a pharmaceutical company who are manufacturing these drugs, they were ready to sell that drug only to doctor or to the hospital. But again, Chemist Association came into picture and whole scenario was changed, and again this is available over the counter. But it should be strictly on prescription of doctor, then only this misuse can be avoided. But it comes under Food and Drug Department, and they are not that strict as far as this regular inspection of all the chemists, etc. is concerned. How much stock they have of this medicine, etc. If they becomes little strict, then misuse can be very difficult to deal with.
there are a number of cases of ectopic pregnancy also, which we have seen after the use of I-pills.
Yeah, absolutely.
Ectopic pregnancy, Rh negative patient, there are many issues for over-the-counter medicine.
Yes.
Yes, madam. Madam, I want to say that, as you said, if we refuse to these people, then what is they do? They go to the chemist and they take the medication. So as far as we are concerned, if we take a proper history and we try to make them right and take the responsibility of this, that they have not undergone any sex determination, which they can give in writing, then I think we should go ahead. Otherwise, they'll do something which will really put them in their health in jeopardy.
Absolutely.
Yeah.
And I tell you what government says in this issue: ensuring access to comprehensive abortion care while addressing gender biased sex selection. The government of India is committed to ensuring access to complete abortion care for women as a part of the reproductive, maternal, newborn, child and adolescent health initiative under the National Health Mission. So sex selection is not a legal ground for termination of pregnancy. The opinion of the provider is adequate to clarify grounds for providing abortion services. Various steps are being taken at the policy, program and information communication level to ensure the same. These, however, need to be translated into the action at the state and district levels to ensure that women have access to complete abortion care services and do not face morbidities and mortalities due to non-availability of information and services. So that sort of justify everything what we say.
So conclusion remains that the person, we should provide her the MTP services, but along and convince her for the sterilization because she doesn't want any further pregnancy. That is, I think, the best solution for her.
And what if she refuses for the sterilization? Then also we have to help her in getting the abortion done.
At least provide some contraceptive like
Some IUCD like.
Can I say something?
You are so not.
In my hospital, we have made it a point, because what happens whenever there is a PCP&DT inspection and when the STM comes, he will, arbitrarily open the file and he will just say, there were 2 girls and SD must have been done. So as a rule, what we have done, we in the clauses, MTP clause, we have added one more. We write it with our pen that I solemnly affirm that we have not done any sex determination before coming to the hospital. Once you write and take the signature of the lady, you can go ahead and you can perform. Then you become safe.
Absolutely.
Otherwise, whether patient accepts contraception or permanent ligation or not, I mean, you cannot force a lady to accept the methods of, permanent methods of ligation.
Yeah.
Absolutely. And another thing is that if you are really scared, you can refer her to government hospital.
Yes, absolutely.
We get a lot of these patients.
That's exactly Dr. Ila, what
absolutely.
we have made, all 5 of us.
We are coming to the consents, which form to be filled. So we have now the documents, consent form C. Like we have A, B, C. A is for approval of the place. B is the approval given, registration. And the consent form C is for the consent. Then if for MTP less than 20 weeks, we have to fill form 1. For 20 to 24 weeks, we have to fill form E. And more than 24 weeks of gestation, form D filled by the medical board. So form 1 and form E should be filled within 3 hours of MTP, both for surgical and medical management of abortion. In both the cases, you have to fill these forms within 3 hours of the abortion. It is mandatory to fill all 4 forms whenever MTP of a normally localized and live pregnancy is done. Forms need not be filled in the cases of ectopic pregnancy, abortion or incomplete abortion. Record all the information in the following forms, irrespective of the technique of abortion and also irrespective of any trimester. Form 2 monthly reporting form. Previous month data must be sent to the district CMO within the first week of every month. This is to be done in both the cases, medical management as well as for the surgical management. And then question comes, what is the upper limit of gestation age and when medical management of abortion is contraindicated? So MMA can be done up to 9 weeks in this new act. Before that, it was 7 weeks in the previous act. And conditions where medical methods are contraindicated and surgical evacuation must be done after stabilizing the patient, like in pre-existing heart disease, coagulopathy or anticoagulant therapy, anemia, severe renal disease including high BP, severe liver disease, severe respiratory distress disease and asthma, long-term use of corticosteroids, and chronic adrenal failure and controlled seizures and inherited porphyria, glaucoma, etc., etc. So these are, we should be very, very careful while doing even medical abortion if we are doing it. So how to maintain confidentiality of patient? That is a very, very important part of the MTP Act. A serial number should be assigned to all the MTP seekers according to the current year Form 3 or admission register. In this, you have to take the number of the case of that year and oblique the year. So this is the serial number which you have to give the name of the patient. Instead of that, you have to write that serial number in all the documents. All subsequent records should have that serial number. Duly filled Form C and Form 1 and E must be placed in an envelope and sealed by an RMP to be kept in safe custody until it is sent to the head of the hospital or the owner of the approved place. This is for both the medical abortion and surgical abortion of any gestation age. Form 3 admission register for case records. It is also a very secret document. All the cases of surgical as well as medical method of termination of pregnancy must be entered. It is a secret document. Do not open to all, but open under the authority of law. Confidentiality has to be maintained. Keep under the custody of owner, head of the hospital, and preserve for a period of 5 years from the last entered case. So is there any sense, I have already talked about, what punishment given if place is not approved or doctor is not qualified or documentation is not complete or confidentiality of women is revealed. So penalties are anything contained in the Indian Penal Code. The termination of pregnancy by a person who is not a registered medical practitioner shall be an offence punishable with rigorous imprisonment for a term which shall not be less than 2 years, but which may extend to 7 years under that code. No registered medical practitioner shall reveal the name and other particulars of a woman whose pregnancy has been terminated under this Act, except to a person authorized by any law for the time being in force. Whoever contravenes the provisions of subsection 1 shall be punishable with imprisonment, which may extend to 1 year, or with fine, or both. So failure to maintain document, this is another penalty which we have to see, that if we are not able to maintain these forms, we have to give a fine up to 1,000 rupees. So now I'm coming to case 2. This case, if expert has to say anything in this case.
Yes. Before we switch over to case 2, let us discuss something about consent. You mentioned that consent should be taken in Form C. It is absolutely right. But this consent is very simple consent, that I gave my consent to terminate my pregnancy. Absolutely. So it is not informed consent. So you will have to go with 2 consent as far as termination of pregnancy is concerned. One consent in Form C, which is very mandatory, and one more consent, that is informed consent. Whether you are going to terminate by medical method or whether you are going to terminate by surgical method. And for that, you have to simply visit Foxy website. On Foxy website, under Foxy Uniform Consent is available. And we 3 medico-legal experts, Dr. Dilip Walke from Pune, Dr. Nikhil Datar from Mumbai, and myself, Dr. MC Patel from Ahmedabad, we have prepared 30 different consent. And in those 30 consent for medical termination of pregnancy by medical method and by surgical method is available. You can download and you can use that. So in any case of termination of pregnancy, you will go with 2 consent in Form C and one more consent, that is informed consent.
That is absolutely correct, sir. You told us that day, but I just forgot.
Yes.
Forgot to mention this.
But no one is doing that. Practically,
No. In Cloud9, we are doing that.
But are we not increasing our workload by filling 2 forms?
No, it is simple. One form you have to download and get it signed by patient. And
first of all, we tell the patient whether she wants a medical abortion or a surgical abortion. She gives the consent. I am ready for whatever. And then we have to fill only Form C. Why overload ourselves with filling the form?
Form C is.
Sir, हम अपना काम बढ़ा रहे हैं ना बिना बात.
No, it has to be.
But to be on safer side legally, I would say.
So legally, what will be the implication if we don't fill up that consent form?
Yes, consent in C is very much mandatory as per MTP Act.
A safeguard to us.
Yes.
Who is? Vandana.
So I'm going on to the second case.
No, just a minute.
नहीं, but ये clear नहीं हुआ है because देखो ऐसे हम OPD slip पे when we talk to the patient, we explain her both the methods, medical as well as surgical, and we write on the OPD slip that she has been explained both the methods and she wants to go with either. So there is a need to fill the informed consent form again.
Whichever method she decides to go for, but you are under obligation to have consent in informed consent form also, because if at all any complication happens, and if she tells that I was not...
Vanna, please mute yourself.
इसके लिए जो आई का बर्तन था एक कढ़ाई जैसा था उसी में
Dear Vanna,
ma'am, can I add something to what sir has said? Because sometimes suppose MTP is to be done under general anesthesia. Won't you take separate consent for anesthesia? So I think it is a good idea suggested by Dr. Patel that we, if available, such forms can be downloaded from the website, and we can additionally put.
Yes.
it is very, very important. Actually, what sir said is a mandatory thing, because you are taking a legal consent, but you are not taking a procedural consent. So you have to take a procedural consent, informing everything that what you are going to do, what are the complications, and how should you follow up, and all those things. The consent is mandatory, as sir said, and we should now start this second thing to start filling up that consent form, which is
I'm the consent for anesthesia. Anesthesia is not our responsibility. Then, in this, if we do not take a separate in case we do not take a separate consent, the patient can later on say that complications and side effects had not been explained to me, and it will not be considered as an informed consent.
But Form C clearly says, I authorize Dr. So-and-so to perform MTP on me. That explains everything, yeah.
That is a kind of a unpaid consent which has been made for MTP. But whatever you need to explain, that needs to be done separately.
Legally,
please unmute yourself.
I think she is not.
Ideally, I fully agree, and I think those who are not doing it should start filling up this informed consent form of the proxy. But legally, I just want to know what will be the legal implication under the MTP Act if we don't fill up the Foxy's informed consent and only take the consent of the patient in the MTP Form C. Dr. Patel,
irrespective of MTP Act provision, for any surgery, any procedure, whenever you are going for, are you taking informed consent? The same way you have to take medical termination of pregnancy also. Form C is mandatory, but informed consent is equally.
Ma'am, I would clarify and I would add on to what Dr. Patel is saying.
अच्छा ठीक है.
Okay. So ma'am, I would just further clarify on what Dr. Patel is saying. Basically, the legal implication to informed consent and having it and not having is that मैम आप ऐसे समझिए इस चीज को कि इन्फॉर्म्ड कंसेंट बाय लॉट ऑफ प्रेसिडेंट्स जो सुप्रीम कोर्ट के सेट हैं या रूल्स एंड रेगुलेशंस, इट हैज बीन वेरी क्लियरली एंड अप देयर इन द क्लाउड एंड इट हैज ऑलवेज बीन एग्जिस्टिंग कि अगर आप इन्फॉर्म्ड कंसेंट लोगे आप ज्यादा सेफ गार्ड रहोगे, बिकॉज सिर्फ कंसेंट इज नेवर इनफ. The only consent, and it has been laid down in a lot of precedents also by Honorable Supreme Court. So इसलिए informed word लगाया गया था. और informed word का दो चीजें उस टाइम चाहिए थी informed करने के लिए. क्या inform करना है आपको? एक inform ये करना है कि हम क्या treatment दे रहे हैं. दूसरा हमें ये इन्फॉर्म करना है कि उसकी कॉम्प्लिकेशंस क्या है, और तीसरा हमें इन्फॉर्म करना है कि कौन डॉक्टर कर रहा है, so that we don't have any ghost surgeons or someone else, right? So these three were the main purposes of it, and it cannot be substituted by just consent. And I think what we are discussing here is कि form C जो है वो सिर्फ एक consent है. So always to protect ourselves and to have a shield around ourselves, there's an informed consent. And now coming to Dr. Suman's point, कि are we burdening ourselves? So ma'am, से अब ये डिलेमा है. अब आप ये कहोगे कि हम बर्डन हो रहे हैं, डेफिनेटली हम हो रहे हैं. We have always been burdened. And now it's just growing at another pace. Now here, what I would like to add is, your perspective is very right, but in the same time, जब आप कोर्ट में खड़े होते हैं ना, तो फिर हमें यही डिफेंड करना पड़ जाता है कि आपने क्या बताया. So now as a advocate, I am telling you कि वो एक पर्चा जो है वो आपको ये बताने में हेल्प कर देगा कि जी मैंने ये बताया और मैं ये बोल के मैंने इस पेशेंट से डील किया. अब वो जो सिर्फ फॉर्म सी होगा वो आपको ये नहीं बताएगा. तो मैं एज एन एडवोकेट, मेडिको लीगल एडवोकेट, मैं ये सोचती हूँ हमेशा कि मेरे पास अगर कोई मेरा फेलो डॉक्टर आता है और वो मुझे कहता है कि डॉक्टर निधि गो एंड डिफेंड मी इन द कोर्ट, मैं उनको ये बोलूंगी सर काश आप ये लिखवा लेते, या मैम काश आप ये लिखवा लेते तो हम सेफ हो जाते. क्योंकि मुझे वो चाहिए बोलने के लिए जो मुझे जज को कन्विंस करे, और यही कन्विंस कर सकता है मैम, इन्फॉर्म्ड कंसेंट. सो आई होप आई एम एबल टू क्लैरिफाई लिटिल बिट ऑन दिस लीगली. And
absolutely, Dr. For highlighting and stressing upon the importance of this consent form to safeguard ourselves. So I will like any one of the expert to give the right message from the case number 1. Only one person, she should enumerate all the points what we has to be followed practically.
See, can I speak?
Yes, ma'am. Boliye.
See, when we give a medical method of abortion, we are just orally telling her, suppose that it has got a failure rate of this percent, and you have to visit me 3 times, once today, then 48 hours, and then after 10 days. If we do not give that signed paper within the sheet, and if she doesn't turn up and turns up with some problem, then we will be responsible, because we have no evidence that we have advised her to come in 3 visits and all these things. That failure rate is this much, and in case it fails, you have to go for DNC, the termination by surgical method. All these things can only be signed when you are giving medical method of abortion. Similarly, you are taking consent for all surgeries, so informed consent for this surgery is as good as for others. Same consent you can always take for medical abortion. That is she's just giving you the right to do her MTP, but what method you have to justify, whether you are going for medical method or surgical method. So that is what we are doing. We are taking a separate consent for medical method of abortion and separate for surgical method, so that she knows what she has to follow.
And Nidhi, you want to say something?
So I want to conclude to the informed consent form is a must along with the consent form C. That is the final conclusion.
Yes.
मैम I would just like to add one more thing, very small thing. अभी बात हो रही थी कि Foxy से हम डाउनलोड कर लेंगे. I have not gone through that, and with all due respect to the authors of that consent, definitely वो बहुत particular होगा MTP के related. That's why Dr. Patel is suggesting all of us. But आप ऐसा नहीं है कि आपके पास आप वो डाउनलोड नहीं कर रहे हैं या अभी नहीं आपके पास अवेलेबल है, तो आप कोई भी जो आप सर्जिकल कंसेंट या कोई भी हाथ से लिखा हुआ कंसेंट, बिल्कुल मैं आपको ये ट्रीटमेंट दे रही हूँ, दैट वुड आल्सो वर्क. बिल्कुल. अगर नहीं है फॉक्सी वाला, नहीं टाइम है डाउनलोड करने वाला, दैट वुड डू. There is nothing wrong with it. The
form of the Foxys are excellent.
Yes, वही मैं कह रही हूँ. I have not read it, but I am saying suppose it is not handy. Suppose it is not handy. Not handy, then go about it. अगर वो डाउनलोड कर लोगे तो वो बेस्ट प्रैक्टिस हो जाएगा.
Dr. Nidhi, when we prepared all those consent under a Foxy uniform consent, we have taken page of famous case of Sameera Kohli versus Prabhaman.
Sir, I am not doubting.
Let me clear, it is for all. And we have prepared those consent in 2 parts. Part 1 is information. So information, say for example, name of procedure, medical termination of pregnancy by medical method, or medical termination of pregnancy by surgical method. Then meanings, what is the meaning of termination of pregnancy by medical method? Then indication, what is the indication for which we are going to terminate that very pregnancy? Procedure, how this pregnancy will be terminated, consequences of refusal of consent, alternatives of termination of pregnancy, we have mentioned each and everything. Probable side effects also we have mentioned. And part 2 is undertaking. So whatever we have explained in part 1, that is information related to procedure which we are going to do, patient will go with undertaking that we have understood everything and then after we have given consent. So it is very much safe as far as practice is concerned. This is not for medical termination of pregnancy only, but all other consents available on Foxy website for cesarean section, for hysterectomy, whether it is abdominal, vaginal or endoscopy, os tightening,
Dr. Patel,
hysteroscopy, it is available.
Dr. Patel, what I'm trying to say here is that suppose if it's not handy, I am not saying that I agree, I bow down to your consents. It could be the best practice that we could ever have. But what I'm saying is that suppose it's not handy, then even if you get it written by your hand,
Yes.
I am here to safeguard my fellows in whatever way it could be.
Yes,
that's what I'm trying to say.
So okay, I'm switching to the case 2.
One more point regarding the envelopes. How many hospitals are keeping the MTP records in the envelopes?
Everybody.
I served the government of Haryana for 22 years. We never did that.
No, we are all doing it.
Nowadays it is kept everywhere.
Yeah, but this MTP Act is since 71 now. We were not doing it.
No, it was not in 71, but in last 6 to 7 years, now it is very well percolated in the gynecology.
That's a part of confidentiality. It has always been there, but we were not doing it. I don't think the government hospitals are doing it. Register is maintained, but the envelopes are not maintained.
Ma'am, envelopes are not mentioned. It is written that confidentiality has to be ensured. रजिस्टर में एंटर करो पर रजिस्टर ऐसी जगह होना चाहिए
इंफॉर्मेशन सालों से प्रैक्टिस है 7 सालों से एनवेलप में रख के जो हेड ऑफ द डिपार्टमेंट है उसका एक क्लोज काउंटर है जहाँ पे वो सारे एनवेलप्स रहते हैं
और कीपिंग इट इन अ लॉक्ड सूटकेस.
Ma'am, previously there was no awareness that there was something called as an MTP Act.
Now it is
private practitioners, none of them were even aware that there was an MTP Act.
This is actually for awareness of everybody because this is being practiced and many of you not practicing because even medical abortion में बहुत सारे लोग फॉर्म नहीं भरते, कुछ नहीं करते. मैं भी फॉर्म भरती थी लेकिन भेजती नहीं थी क्योंकि मुझे लगता था कहाँ भेजूं.
आप तो अगर
चीजें हैं, प्रॉब्लम्स हैं जो कि you have.
If you are working in a hospital, you will send it to the in charge, but single unit, single doctor.
No, you have to. I told you that. No, you have to send it to the in charge of the hospital, which is approved place for you. Because
for example, my place is approved.
Dr. Suman, आपको approved place से attachment लेना पड़ेगा तभी आप अपनी clinic.
नहीं, मैं तो वैसे अपनी बात नहीं कर रही. I'm not doing anything at my place. I'm doing at the hospital only.
Now you should start doing it if you are not doing it.
हाँ, if you are not there, please start doing it.
These webinars are meant for that कि we improve ourselves. Keeping the record in
MTP Act is very less understood by people. Very less understood. So I want that because आज से 6-7 साल पहले when I presented it, it was an eye opener for me. And since then I started practicing all those things. But I know that there was a lot of fights between me and hospital that we should not do this and we should not do this. उनको दिखाना पड़ता था कि देखो ये है.
Second case.
I switch on to the second case. So Mrs. M, 29 years old, primary, at 22 weeks, come to for termination of pregnancy. Her divorce is filed and she doesn't want to carry the pregnancy. She is uncounselable regarding continuation of pregnancy. Her parents are also supporting her as there is no chance of continuation of marriage. So should one do the MTP? What are the indications for MTP between 20 to 24? Consent from husband required. What measure to be taken to save yourself if husband accuses you? What consent to be taken and which opinion form to be filled and how many doctor signs required? So as there is a change in the 20 to 24 weeks abortion cases where there is a clause that is a change of marital status during the ongoing pregnancy, widowed and divorcee. So because this is there, so we can go ahead with the abortion. So there was a case in Punjab and Haryana High Court. Women living separately without divorce can terminate pregnancy without husband's consent. Justice Kuldeep Tiwari had said, the court observed that while the petitioner does not fall within the purview of widow or divorcee, a decision to live separately from her husband without legal divorce still qualifies her for pregnancy termination under a permissive interpretation of change of marital status. So we are very much sort of legal to
Protected by law, yeah.
the pregnancy, and then we have to take consent of 2 doctors if the pregnant woman falls under this category. So these are again the same documents, and we have to fill Form E in this case. So this is the case. Then now I need the opinion of experts if anybody wants to say something.
So when pregnancy is more than 20 weeks and less than 24 weeks, just you mentioned, one option is available, change of marital status. But in this particular case, still case for divorce is pending. Yes. Judgment is not yet come. So in eye of law, she is married, she is not divorcee. So that indication is not available to terminate pregnancy.
Yes.
If at all you terminate pregnancy on that indication, you may be put into trouble. So you cannot terminate pregnancy on that indication. If at all patient is interested to get pregnancy terminated, patient will have to go to Honorable High Court seeking writ petition for seeking termination of pregnancy. Otherwise, you cannot take decision because still she is married in eye of law because still case is pending. And as far as signature of husband is concerned, when patient is major, when patient is mentally sound, nobody else can give consent on her behalf to terminate pregnancy. Only and only she can give consent, and husband's consent is not at all required. But in this case, in any case of termination of pregnancy.
Sir, but if patient is having mental agony, anxiety regarding this pregnancy,
that indication
that doesn't come
available
under
up
the
to
3
20
categories
weeks.
that you mentioned, no?
Madam, Ilaben, that indication is available up to 20 weeks of pregnancy only. Mental trauma to the patient if pregnancy is continued. But here pregnancy is more than 20 weeks, that is 22 weeks you mentioned. So that is why this indication is not available.
Dr. Ila, in your case also, the patient went over to court to get
yes. What I like.
Then a patient may go with.
This was the case where judge given this.
She may go with prayer with interim relief till final judgments come. As far as divorce part is concerned, I should be permitted to get my pregnancy terminated. And if court is convinced and court give permission, very well you can terminate pregnancy.
So this means that in this case also we have to refer the patient to the court.
Naturally.
And we should not take the decision ourselves.
No, we cannot. We
So that is a very important point which we learned today, that in such cases, because I understood from the indication of the 20 to 24 weeks that we can go ahead, but as sir has told that we have to be really careful in such cases.
Because she is not divorced as yet, no?
Yes, because her marital status is concerned, she is still married, not divorcee, because case is yet to be decided.
And I think, ma'am, this is we have to separate our emotional और हमारी अपनी thinking को ना यहाँ पे separate करना पड़ता है, and that is why we need to go to the court. हमें ऐसा लगेगा कि हो जाएगा divorce, but that is not for us to think. That is for the court to decide.
Yes, exactly.
So यहाँ पे I think थोड़ा emotional angle आता है.
But now clear message.
So final message is, Dr. Raj, please, ma'am.
I think so. She must be tired. But the clear message is that after 20 weeks, it is not only that the patient wants it just to terminate, because she is in the process of divorcing, and such case scenario we come across clinically very often. So no one should terminate till the permission from the High Court is given to terminate the pregnancy.
Okay. But the latest law says you can do it up to 22 weeks. After 22 weeks.
No, it's not 22.
It is only 20 weeks.
So do a change of marital status.
So now when
She's not changed yet. She's not changed yet. So these are the dilemma.
When we are filling MTP forms, they are asking us up to 20 weeks, one person can sign, but 20 to 22 weeks, you need 2 persons sign.
20 to 24 weeks, not 22.
Yes, 20 to 24 weeks.
Madam, when pregnancy is more than 20 weeks and less than 24 weeks, you can terminate with opinion of 2 registered medical practitioners, not in all cases. only in the cases for which indications are given. Only 7 indications are available from more than 20 and less than 24. It is seen on the screen. So if any of this indication is available, then only you can terminate pregnancy more than 20 and less than 24, even with opinion of 2 registered medical practitioners. Otherwise, you cannot.
See, just
Okay, so this is a very valid point, and we take it as that if there is a such kind of case, then we have to keep it with a pinch of salt, and we have to send her to the court to get the permission. Then we will save ourselves.
yes, yes.
Okay. Thank you, sir. Thank you so much. So now I am coming to the 4th case. A 17-year-old recently married girl visits clinic with 6 weeks pregnancy for medical termination of pregnancy with her husband who is 20 years old. So how to deal with that, and what is POCSO Act? So as you all know that the POCSO Act, when it came in vogue, and we have to be really careful regarding such cases, the Government of India enacted the Protection of Children from Sexual Offence Act 2012 to prevent and address child sexual abuse. So will you inform police? What will happen if you don't inform? So information to the authorities is must. That is a very, very important take-home point. A pregnant minor girl, married, unmarried, is considered a victim of sexual assault, and a medical provider is required to report the pregnancy to the appropriate authorities, even if the girl has not expressed a desire to take legal action, failing which the person can be punished with up to 6 months prison and a fine. So what are the authorities whom you can inform or can give intimation? Doctor should bring the incident to the notice of the Special Juvenile Police Unit or the local police, or call on Childline 1098. Child Welfare Committee and local police has to be connected with MTP Act guarantee protection for providers who act in good faith. So what consent to be taken and from whom in this case? So, sir, do you want to speak anything?
Yes. So, here in this case, patient is 17 years. Irrespective of her willingness whether to continue or whether to terminate, you have to inform police under POCSO. And once patient is to be terminated, then you will have to again inform police that you are going to terminate pregnancy of that very patient on this date, and you please send your representative to collect product of conception. You will preserve product of conception in normal saline and you will hand it over to the police. So it is very important not to, because you are under obligation to inform police under section 19 of POCSO Act, and failing which under 21 section of POCSO, imprisonment of 6 months, just you mentioned, is there. Who will give consent? Patient is minor, so patient cannot give consent for termination of her pregnancy. So her guardian will give consent. So any guardian who is major and mentally sound can give consent. Guardian, here word guardian is used. So what is the word guardian means? Any person who guards the patient, need not to be legal guardian, need not be her husband or father, mother or so. Any person who guards the patient can give consent with and mentally sound in this situation. But you will have to inform police, you will to hand it over product of conception in normal saline to the police. If police doesn't comply, because many times police is not complying your information, or so you will have to inform CWC, just you mentioned. And once you inform CWC, your job is over.
Yeah.
So one question. Regarding in this case, especially when the husband is accompanying and she is married under 18 years of age. So the product of conception, we know this is for the DNA.
No, it is the evidence for the.
It is evidence. It's not a rape or anything.
No.
Even if
so we still have to preserve the and send it to the.
Agree, madam. In POCSO Act, it is very simply written that being a responsible citizen of India, once you come to know that she is victim of sexual assault under POCSO Act, you have to inform police. This is written in very simple language.
Information is okay, sir, but preserve.
Let me come to that. So you are under obligation to inform police. Now what police has to do, that is police job. Your job is just to inform. You are not a complainant. You are simply informer. You have to inform. Then police will take the case. Whether he will file case against her husband or so, that is up to them. Nothing to worry for that. But if you fail to inform, that you may invite litigation under section 21, and there is a provision of 6 months of imprisonment, and one cannot afford that. That is why we have to.
So can I ask one question? I'm working in a government hospital.
Yes, madam.
How do you ascertain the age of the patient? The patient says she's 19-year-old. Her Aadhaar card says 17 years. And Aadhaar card is, I don't know how they get it. They are not educated also. Even their parents make it at some this thing. So is the Aadhaar card used to see the age, or how do we confirm the age of the patient?
So
medical investigation.
Determination of age is burden of doctor. It is mentioned. So you have to determine the age either by Aadhaar card or school living certificate, election card, driving license, or any document you can go with. If Aadhaar card says that 17 years and it says that she is 19, then you have to go with Aadhaar card, because patient may be telling lie. So if Aadhaar card is 17 years, then
Ma'am, we trust documentary.
In other words, are we supposed to take the Aadhaar card of every patient?
Yes. That's very important, Dr.
Whenever
Jharna.
you are in little doubt that patient seems to be less than 18, it is always better to be on safer side to have a copy of Aadhaar card. And not only that, that copy should be attested by that very patient. Because if the patient has given you a fake Aadhaar card or fake copy, you are out of problem. Because once she attested that copy, then you are out of problem.
Sir, can I say something?
Any doubt still about the age, then you can take the radiological evidence.
Yes.
As a proof.
Yes.
I think
Yes.
that's
So clinical examination, dental examination, radiological examination, and you can request police also that I am in doubt as far as her age is concerned, and forensic medicine opinion is required. They may refer patient to medical college forensic department to determine the age.
Very
But
nice.
whatever you do, it looks that you have taken utmost care in that very case.
Thank you, sir.
So consent in this case, as husband is an adult and he is her guardian too. So his consent will be valid for her MTP. Does the medical provider have to legal obligation to preserve the products of conception for abortion services for minor girls? Product of conception to be preserved in refrigerator as evidence and handed over to the authority, as we have already discussed. Providing treatment and necessary medical investigation is the prime responsibility of the examining doctor. And that admission, evidence, collection or filing a police complaint is not mandatory for providing treatment. If you want to provide the treatment, you start your treatment without waiting for. But you should not delay the treatment if it is required immediately. This means that provider can inform the authorities about the pregnant minor even after performing the abortion. Therefore, it is important to provide medical care at the earliest while legal proceedings can continue simultaneously. It is unnecessary to approach the authorities for permission to terminate an adult or minor rape survivor's pregnancy within the permissible first 20 weeks. As defined under the MTP Act or thereafter, if such termination is required to save her life. Sir, you have to say something on it.
So if indication is available, if pregnancy is less than 20 weeks, naturally pregnancy caused by rape or so is available. If it is more than 20 weeks and less than 24 weeks, one more option is available when she is minor. So no need to inform, take permission of police or even court also. You can very well terminate pregnancy, but you will hand it over product of conception to police preserved in normal saline.
Sir, I have one question.
Yes.
Like we have said that if a patient of 14 weeks comes to us and has already have two female children, still we will go for termination because we do not want her to landed up with some unauthorized people. Here, in my practice, I refuse all the minor girls. all the minor girls as a rule. So should I refuse them or should I entertain them?
Why should you refuse?
No, let me clear. Even if you refuse, but once you came to know that she is pregnant and she is less than 18, you are under obligation to inform police.
Definitely.
If you haven't informed and the patient goes to another person who informs, then you are in a trouble.
Once you have seen that very patient, examined that very patient, and once you came to know that she is pregnant, she is minor, you have to inform police. Simple.
And it will be of no use to not treat, because as ma'am said, for the you should treat the patient. So आपको information आपको मिल गई, you are under the obligation now. It is definitely but it is not going to make any difference. That's what I'm saying.
Once I start doing that procedure, they'll run away from me.
Agreed. But
ma'am, that's their prerogative. But we are not escaping our responsibilities and liabilities any which ways.
Even if patient runs away, but once you came to know that she is pregnant and she is minor, you have to inform.
Otherwise, you will be in trouble.
Your job is done whether you do MTP or you send her or they run away. That is so clear.
Should we prepare a link between our hospital and the SHO of the area? I mean, the mailing facility should be available. I think even if you drop a mail also, that is more than sufficient.
Yes.
You can send it by mail, by registry.
Any mode is
personally, fine. But whenever you send personal letter, then it should be, you should have acknowledgement of receiving that very letter.
Yeah.
And many times local police station, police officer may not comply, that you can inform higher officer also.
Yeah.
You said CWC.
Yeah.
Yes, ma'am.
Yes.
CWC last option.
No, if you have informed CWC, then you can go ahead with FTP.
Yes, ma'am. Absolutely, you can.
Absolutely.
Then CWC people will take charge and they will inform police, etc. That is their job. Once you inform either police or CWC, your job is over.
दिल्ली में तो 100 डायल करो फटाफट आ जाते हैं, PCR आ जाती है,
112 हो गया, अब 112 हो गया, 112.
So because to dial 100 is very important because it is recorded call.
Recorded
whenever you are informing any information. But in
और
this
उसमें receiving
situation,
भी नहीं लेनी होती, sir. That's the best part.
Let me complete. In this situation, first you will identify the person whom you are giving information. Name or in police station they are given Bakkal number. So if they are ready to give Bakkal number, then you will mention in your case paper name so and so, Bakkal number so and so, police station so and so, date and time, and then you inform. Because whom you are informing is also very much important.
Sir, just a minute for a practical purpose. Suppose I tell that now I am going to inform to that 100 or 112, whatever it is. Then not only they'll run away, we are making them, they will definitely go to some person who will not inform police.
But Dr. Surekha, you need not tell them that you are informing the police. You just inform the police and don't let them know.
But ma'am, that is not your problem if the other person doesn't inform you.
Let me clear. Willingness on part of patient or patient's relative is not at all required to inform police.
Yeah.
You have to just inform.
You have to inform.
Yeah. Even if you see the ultrasound में pregnancy है minor girl की, you have to inform. If you haven't informed, you are in soup.
Even the ultrasonist has to inform the person who is his first time.
Any patient who comes with pregnancy, you have to inform. So I am switching on to the case 5. Mrs. DP, 34 years old, patient, third gravida with previous autistic daughter, 6 years old, and one missed abortion, visited clinic and with 12 weeks pregnancy with an IPT result showed GLR-X variant. So she was advised amniocentesis and got it done at Sir Gangaram Hospital and fish was negative. She waited for report which came out to be duplication in gene 22 and anomaly scan was absolutely normal. She continued her pregnancy but later on she got suspicious about duplication defect as her daughter was autistic and she didn't want another handicapped child. So she insisted for termination. In spite of counseling, she persisted for her request. So in this case, what should you do? You will obviously refer her to medical board, right?
Gestational age
So now she is how many weeks?
She is 26 weeks.
Oh, definitely to the medical board.
So we are going to send her to the medical board. And what is the medical board? Where is medical board in Delhi, and which opinion form to be filled? So members of the medical board are gynecologist, pediatrician, radiologist, and any other member as notified by the government. And its function is to examine the woman and her reports, provide the opinion of medical board in Form D, rejection or approval within 3 days of receiving the request for MTP. And medical board's discretion is there is no gestational upper limit provided the medical board gives the permission to ensure that MTP when advised by the medical board is carried out with all safety precautions along with appropriate counseling within 5 days of the receipt of the request. And that there is another point that it is always better to do a feticide before MTP must be considered for MTP beyond 24 weeks of gestation, because if the baby remains alive, then it is a problem for you. So, sir, expert opinion for all of you.
So can we directly refer to the medical board, or it has to come through the court?
No, you have to refer to the medical board.
Okay.
And medical board is in all the government hospital. But there are few other hospitals who have medical board, but they do not know. Like Gangaram has medical board, but they do not know about it. Apollo Hospital has medical board, and Lady Harding, Maulana Azad, all these hospitals has medical board, and you can directly refer to the medical board.
Max Patparganj is also under.
Yeah, Max Patparganj है, लेकिन वहाँ कमेटी बनी नहीं हुई है.
बनाएंगे.
उन्हीं को नहीं पता है कि their name is there in the.
Can I ask something?
Yeah. Why not?
Dr. Ila, what I wanted to know is why do we have such few hospitals having the medical board? What is the procedure for getting the medical board for your own hospital? Because the composition of your medical board is practically there in every tertiary care hospital, isn't it?
Yeah,
it should be, but you have to choose the people, and people will have to take the responsibility. If they do not want to take the responsibility, then it is difficult, because it is a very tricky situation, and everyone has to be very wise in selection of cases.
Yeah, and authorities have identified these hospitals.
Yeah, so I want to know
it on your own.
Authorities, because we have a patient in West Delhi, and this was basically a kind of variant, but it was showing trisomy 18, and the patient, by the time they went, they had gone to Maulana Azad Medical College, incidentally my alma mater. But by the time the board was instituted and it was told she was already 32 weeks, and the patient decided to continue the pregnancy. What I'm just saying is that they faced a lot of problems, because at that time there was some strike going on. This was about 2 years back, 2 or 3 years back.
But now the situation is better.
Yes,
situation is better. This patient got terminated at Apollo Hospital, and they did abortion. The committee
saying a lot of patients don't want to go to the government hospitals, and here
so Apollo, I'm talking about
hospitals.
I'm talking about Apollo Hospital. Apollo mein hai medical
so
board.
Do the hospitals apply to get a certificate from the medical board?
Yes.
If you send the patient to Maulana Azad Medical College, even there it is very comfortable.
एक्चुअली गवर्नमेंट ने ये लिस्ट जारी करी है, गवर्नमेंट ने लिस्ट दी हुई है. अभी ऐसा कुछ नहीं है कि आप अप्लाई करो तो आपको मिल जाएगा, ऐसा कोई प्रोविजन नहीं है अभी.
Okay.
This is only given by government. So medical board is already decided, and you have nothing to do in this case. It is available. Everything must be considered
for the medical board in the private sector. I think that's what everyone wants to know.
क्या? Dr.
Everyone wants to know how to apply for the medical board approval.
You have to just send the patient.
Let Dr. Patel say how to apply for approval.
You're absolutely right, Dr. Raj, because the practical difficulty, Delhi is a vast city. In the whole of West Delhi, we do not have a single hospital which is there in the medical board.
I'm telling this patient is
from Dr. Patel how to apply for the medical board.
Sir, chalega sir.
Yeah.
Sir, hai nahi.
Patel, please.
Sir, hai nahi shayad.
Oh.
सर है नहीं। I tell you,
अरे क्या बात है, इसको मैं इसका ब्लड लो कंसेशन दे दो जो दे सकते हो मेरी
डॉक्टर राज, ये पेशेंट जो है मेरा रियल पेशेंट है। मैंने इस पेशेंट का टर्मिनेशन अपोलो में हुआ है 26 वीक्स प्लस में, मतलब होते होते वो 28 वीक्स हो गई थी।
नहीं, मैं ये कह रही हूँ कि लेट्स हियर फ्रॉम डॉक्टर नेहा और डॉक्टर आरती, दे कैन आल्सो कमेंट हाउ टू अप्लाई, दे मस्ट बी नोइंग।
मैम, you cannot apply for it. I don't think.
अभी कोई प्रोविजन नहीं है। At present there is no provision कि आप ऑप्ट करो कि हमारे यहाँ मेडिकल बोर्ड बना दो। अभी तो गवर्नमेंट ने आइडेंटिफाई किया है, सरकार ने।
Hospitals it is available with Gangaram Hospital.
वो भी आइडेंटिफाइड बाय गवर्नमेंट है।
सेंट स्टीफन में है और एक तीसरा इधर अपोलो हॉस्पिटल। These 3 hospitals are identified.
Ma'am, my dear friends, anybody has any experience of sending patient to the medical board and getting a very quick reply and could manage the patient?
Yes, that's what I'm telling.
I sent to Maulana.
I'm telling that, Dr. Surekha.
Yes.
I'm telling you, this patient is a real patient.
Okay.
And she got terminated at Apollo, though it took time. हालांकि जब मेडिकल बोर्ड पे आप जाते हो तो 3 से 5 दिन में उनको कर देना होता है। They can't be late. लेकिन अगर टाइम लग भी जाता है तो क्योंकि अपर लिमिट नहीं है तो even they did it at 28 weeks.
You can terminate the pregnancy with an abnormal child at any gestation.
Yeah.
You don't need to hurry.
Okay.
Yeah.
And there have been cases
to medical board. I sent my 2 patients to medical board in Maulana Azhar Medical College, and the permission was given, and we terminated the pregnancy.
Yeah.
So now, I think things are much better now. But again, like you said, it wasn't there 3 years back, and what you said now, it doesn't happen in 3 to 5 days.
It doesn't happen, but it is all right.
It happens.
It is available. You can do it at any gestation.
One thing more I want to know from our expert, whether it is must to give the KCL for the feticide before we
Yes.
Yeah, feticide is a must.
No.
Yes. Feticide before MTP must be considered for MTP beyond 24 weeks.
Only in centers who have fetal medicine department as their backup, they give it. But otherwise, it is not needed.
No, ma'am.
In the law.
Ma'am, please allow me to clarify this issue, that even till date, our MTP Act does not give us the right to do a feticide.
That's what I wanted to.
There is always, you have to apply to the court. There was a case where Dr. Nikhil Datar had gone over to court to terminate a pregnancy through feticide. The other day in a conference also, there was a government doctor who said that we are doing it left, right and center, which is absolutely illegal.
Yeah.
There was a case in 2021 of Preeti Bala versus State of Punjab, where the RCOG guidelines had been cited that whenever the pregnancy is 21 weeks, 6 days, at that time you need to do an ultrasound guided injection of KCL in the fetal heart. But it has not been legalized. For every case you need to do a feticide, you have to go ahead.
Ma'am, one
and take permission.
Dr. Arti, I just want to say one thing, that it is written in the MTP Act that if you are sending to the medical board, and medical board will decide whether feticide is done before delivery.
I have not seen it.
Nobody can do the feticide.
I have copied it from MTP Act.
But what to do if the child doesn't die after 28 weeks?
Yes, that is a very big.
What to do?
पहले कंसेंट लेना है मैम, पहले कंसेंट लेना है कि बेबी को हम रिससिटेट नहीं करेंगे और बेसिकली एंड ऑफ लाइफ केयर देनी है, जस्ट सपोर्टिव, कीप द बेबी वार्म, उसको मेडिकेशन नहीं देना ताकि वो रिससिटेट ना मतलब नहीं कर।
मैम कई बार a grossly abnormal child of 24 weeks is born alive and पूरी तरह से alive, and our country does not allow active euthanasia.
Let me clear all this point.
Now, Dr. Saab is there.
Medical board has only power to opine whether this pregnancy can be terminated or not. And if they give reason that permission to terminate, then also they will have to give reason. And if they deny, then also they will have to give reason. They have no power to opine whether feticide can be considered or no. If pregnancy is very normal and even if she is rape victim, then also medical board has no power to opine. medical board can only opine in case of fetal congenital anomalies which are incompatible with life of fetus. So medical board, of course, conferred with power, but limited power. In all the cases, medical board cannot opine. And once case has come to medical board is under obligation to opine within 3 days. And once opinions comes, then that very pregnancy should be terminated within 5 days. As far as more than 24 weeks of pregnancy concerned, at the time of taking consent and at the time of counseling, we will have to counsel that patient and patient party that it is all likely that baby may come alive. And in this situation, who will take custody of that very baby? Can we transfer that baby in NICU? In government hospital, there is no problem. You can transfer in NICU. But in private sector, who will bear the cost of NICU? Because you cannot simply write that we are not going to resuscitate. That is also dangerous one. Because you cannot leave baby at mercy without doing anything as per law. Because euthanasia, just mentioned by Dr. Arti, euthanasia is not allowed in India on today. So we should be very clear at the time of counseling and taking consent about custody of baby. And in this situation, if baby is alive, if patient and patient party absconded from the hospital, you can inform police also in this situation. So there are some odd situations we may have to face, and we should be very vigilant in this type of situation.
Okay, so it's
Ila ma'am, can I clarify one point? Sir, is it 3 working days or 3 days?
3 working days.
3
working days. Now, suppose Saturday, Sunday comes
Yes,
and the
3 working days and 5 working days.
Yes.
And it is mentioned in amendment which came in 2021 MTP.
Thank you, sir.
So it is the last case. Mrs. A, 30 years primary, DCBA twin, 24 weeks plus pregnancy detected with polyhydramnios and double bubble sign in twin A at the time of echocardiography. While her first trimester screening was low risk and on anomaly scan, there was echogenic focus in the heart. Patient was advised NIPT, but she refused. Fetal medicine consultant advised amniocentesis in affected twin, which came out to be trisomy 21 positive at 26 weeks of pregnancy. Selective termination was thought of. So how should we go about?
So as far as selective feticide is concerned in this case, when pregnancy is twin pregnancy, it doesn't, no provision of MTP Act will apply.
Absolutely.
There is no termination of pregnancy in this case. Pregnancy is still continued. So you can very well go with selective fetal feticide with all its prerequisites we have to go for.
So the question is, sir, was medical board referral essential or selective abortion can be done at the center itself?
No, it is a complication of pregnancy you're dealing with. It is not termination of pregnancy.
So it is not important to refer to medical board.
But you will have to mention each and everything as far as your record keeping is concerned, why this was indication, how you approach in that very case, and how you manage that very case. Because if at all something goes wrong, any complication or so, and patient sue you in consumer forum or any other forum, then you should be very clear in your stand how you manage that very patient.
Absolutely.
And abortion is something where the baby is coming out.
Yes.
Whenever you are doing a selective termination, the baby is still inside the uterus and is getting absorbed in the walls of the uterus. So this
it is not abortion.
Considered as an abortion. And this is a similar case whenever there are IVF pregnancies, where there are quadruple pregnancies or triple pregnancies, and you want to reduce the pregnancy. Then in that condition also, that is not considered to be an MTP.
And one more thing, Arti, in
Arti,
this situation, one more condition.
Arti.
Even if your center is not registered, then also you can go with selective feticide. Your center need not to be registered.
Because this is not under MTP.
Yes,
we don't need an
termination
MTP.
of pregnancy.
This is a OBS problem, so we will go ahead and do that. That is treatment.
I think documentation is very important, as Dr. Patel said. इसमें आपको justify करना पड़ेगा what you're doing and why you are doing.
Yes,
And I
exactly.
think that is more than enough in this case, because that is the complication that you're dealing with.
Yes.
And as sir said, not exactly termination. That was
पर
not your
PNDT
purpose, basically.
हाँ निधि, पर PNDT रजिस्ट्रेशन तो कराना पड़ेगा ये वाले सेंटर्स को. PNDT रजिस्ट्रेशन तो
रजिस्ट्रेशन के बगैर नहीं कर सकते हैं.
Madam, PNDT, any different story. When you are doing any ultrasound of any anterior patient, PNDT will come. But once it is decided to go for feticide, then you have already filled up the form as per.
जब आपने एक रेडियो डायग्नोसिस कर दिया ना मैम, उसके बाद you know where that is coming from. So at that very stage, we need to know whether we are PCP-NDT registered or not. And after that, what we are dealing is something obs, as ma'am said, Arti ma'am said. So I think we can categorically differentiate this.
One thing more, to be more safer, one opinion by the genetist or by the fetal medicine person is also valuable to defend your case.
Yes.
Before terminating that, doing the feticide in one.
So it is very common dictum. Madam, in law there is very common dictum. Whatever you do, you should be in a position to justify your action. So if you can justify your action medically, then it is not necessary that you may be put into trouble legally always, because court is liberal that way.
Ma'am, you also have to gain confidence that you are expert in that particular matter. Court will always consider you an expert.
And under MTP Act also there is section 5, and under section 5, if you do anything to terminate pregnancy to save life of patient, and when it is immediate necessary to save life of patient, no provision of MTP Act will apply. You can very well treat that very patient. Say for example, pregnancy of 30 or 32 weeks pregnancy gestation, and patient is having malignant hypertension. What you do? You are going to terminate that very pregnancy to save life of patient. So here, no provision of MTP Act will apply. You can very well treat that very patient.
अगर आप नहीं करोगे उस केस में emergency treatment, then you are probably liable.
Yes, then you are liable. Not to do
so we have to circumstantially understand.
It is an act of omission. You cannot.
We have to understand the circumstances and be confident in what we are doing. It is not necessarily to always add on the experts. We respect experts.
Again, word of caution.
Can I chip in? If you take too much of expert and you are not confident,
burden of proof will be on your shoulder to prove that whatever you did, it was in good faith of patient. So your documentation should be very up to date. Yes, madam.
Sir, there is a fetal medicine specialist with us, and she is raising her hand. She wants to say something. Yes, Dr.
Before she speaks, I will speak. As far as the fetal medicine part is concerned, majority of the fetal medicine courses are not recognized by the NMC. So this part you must know. Secondly is, when you are not confident that genetic expert is going to come talk to me in my favor, or the fetal medicine is going to talk to my expert in favor, you should never push it. Never push it.
Ma'am, that's why we need you beyond 90.
See, we have a sufferer, doctor. Now the court has decided, so I can speak. In Dr. Raj's cases, we asked Dr. Alka Kriplani, and she put her to Genesis, which was not in favor of Raj at all.
Okay, so yeah, ma'am. So any other word for this?
Dr. Ila, one thing, in case this lady lands up into abortion as a complication of that reduction, then where would the case lie?
Yeah, that is an important point, but you will obviously take the consent of.
No, that is a consent. But then medical termination of pregnancy does not apply to this, no?
No. Yeah, medical. Sir will tell. Dr. Patel.
So in any complication, you are facing litigation. The same way you have to face. Here, a provision of MTP Act will not come in picture, because during the process of this fetal reduction, if ultimately patient aborted, then it is a complication of treatment. We have to face that way. Here, MTP Act doesn't come in picture.
Sir, importance of documentation again. And
Naturally.
See, pre-procedure counseling is very important. If you're in pre-procedure counseling, you've given in writing, then once you're reducing it, what the government allows you as far the reduction is concerned, you have to be very clear and tell them. So 3 के 2 हो जाएंगे, but 3 का 1 भी हो जाएगा. कोई गारंटी नहीं किसी चीज की. तो ये अगर आपने काउंसलिंग करी है तो आप बच जाएंगे. अगर काउंसलिंग नहीं करी तो परेशान है.
Madam, pre-procedure counseling is equally important.
Yes,
and I would say post procedure counseling is also equally important. You will have to mention that what you have done and what is the prognosis of this procedure in future, and what precautions to be taken on part of patient which you are going to advise. And you have to mention everything in the case paper. If at all patient doesn't comply or advise, and if something goes wrong, it becomes a contributory negligence on part of patient, and it becomes a good defense in your favor.
And also one very small suggestion, and I know we all do that, but once the procedure is done, I always request to take the patient and their relatives in the confidence that it went well or it did not went well. So it should be very well explained what pre-procedure, intra-procedure and post-procedure. I think everything is very, very important, because I think the patient starts flipping only when they say कि बताया कुछ और था, हुआ कुछ और. So that discrepancy, because we know what is happening, so I think we should keep explaining.
Dr. Nidhi, here I just wish to tell you, now it is the regular practice in City of Delhi is whenever the reduction is done, they are made to wait for 2 hours and ultrasound is done, shown to everybody.
Yes, ma'am. Very important. Very, very important.
Till now, it has not come under MTP Act. So for that, you need to go with what to take permission.
And under law, it will always be a crime, ma'am. It will always be a crime. As of today, it is a crime.
सर आपने 32 वीक्स आपने इंडिकेशन बताया कि सपोज हाइपरटेंसिव क्राइसिस थी या मैनेज नहीं हो पा रहा था, अनकंट्रोल्ड, आपने उसको इंड्यूस कर दिया, तो सर उसको हम इंडक्शन ऑफ लेबर की कंसेंट लेंगे ना, उसमें तो एमटीपी की कंसेंट तो नहीं होगी ना सर.
मैडम, इन्फॉर्म कंसेंट फॉर एनी प्रोसीजर एज वी टेक इन एनी अदर सिचुएशन, वी हैव टू टेक इन दिस सिचुएशन आल्सो.
सर फिर वो क्वेश्चन वहीं तक आ जाता है कि वो की एमटीपी कितने वीक्स तक कहलाती है अब इंडियन एज पर.
ये एमटीपी का केस ही नहीं रहेगा मैडम.
हाँ, वो तो इंडक्शन हो जाएगा ना.
When you are dealing with complication of pregnancy, and whenever you do anything to save life of patient, you are exempted from provision of MTP Act under Section 5 of MTP Act. Under Section 5 MTP Act, it is very clearly mentioned that when it is immediate necessary to terminate pregnancy to save life of patient, provision of MTP Act will not apply.
There was a case जो Bombay High Court में गया था, and this was a case of listen carefully. The baby was 33 weeks gestation. The patient went over to court and said, I want this baby aborted, and the Bombay High Court gave a go ahead to the patient to get this baby aborted at 33 weeks of gestation. This was when the medical board had already refused this termination because they said that this is a correctable deformity and you can get it corrected. But the court went ahead and they said that this choice and this decision will be the mother's, not the medical board's. And denial for a late MTP will not be considered correct by the court in case the medical board is not giving a decision. So this put the validity of the medical board also in question in this particular case. At 33 weeks of listen carefully, they allowed a termination of pregnancy.
Okay. So to conclude,
allow me to conclude, Dr. Ila.
No, just a minute, summarize.
The violation of the MTP Act, the following offence can be punished with rigorous imprisonment for 2 to 7 years. Terminating a pregnancy at a place that is not approved, procedure not recorded in admission register, any person terminating a pregnancy is not registered, mandatory documentation of consent, opinion, case and monthly is not adhered to, medical mismanagement resulting in major loss. Medical method can be given in OPD having displayed affiliation with approved center, do proper pre-procedure counseling. All private site has to be approved only once, not need renewal. Display site approval certificate, Form B at hospital. Check age of girl, woman if less than 18. Follow POXO Act and inform police. Don't deny for MTP. Women not adopt any contraceptive method. Confidentiality of women has to be maintained. All documentation should be completed and kept at secure place. All second trimester abortion should be done where OT and resuscitation facility is there, and patient should be admitted. Spouse consent is not at all required. Consent has to be taken on Form C. So, as sir said, in order to save the life of mother, MTP can be done at any place by registered, unregistered, and the opinion of 2 RMPs is not applicable. RMP must inform the authority within 24 hours of such termination under Section 5 of the MTP Act.
So I'll conclude the rest of the part.
That's something you have never had. You must be willing to do something you have never done. Thank you so much.